Hello friends, welcome all of you. I am Dr. Neha Shah and I welcome you for the second episode of this scalpel series. As I told last time, every Saturdays 12 o'clock I am going to come live on Instagram, my personal page as well as the Swasthya page, and every week we are going to have a guest. Either it will be one of the patient or it will be some renowned doctor, and we are going to discuss some interesting facts about obesity and its relation with different organs. So friends, today we have a very interesting topic. We are going to talk about obesity and its relation to bones, joints. You know, there are a lot of patients we see with so much of knee pains, back pains, even heel pains. So let us hear from the expert. Today I have Dr. Arumugam. I welcome him. Welcome sir for the program. Thank you so much for joining us. And we are going to hear from him as his experience. He is more than 25 years of experience in this particular field of knee replacements, and I think hip and knee replacement is your expertise. So let us hear from him, like, you know, what is the relation of obesity with, first I would like to ask you, what is the relation of obesity with bones in general?
See, when we are around 18, usually the obesity starts much later. So when you're 18, that's when your bones mature and get to the maximum strength. So that time you're around about 50-60 kilos. And obesity sets in much later and usually. So what happens is the bones are meant to handle only 50-60 kilos of weight. And when you put around about 120-140 like the patients that Neha gets, so it gets very difficult for the bone to manage that much amount of weight. So what happens is, even with a trivial fall, you will have a bone injury and fractures, which are not very common in comparatively thinner adults who are having a proper weight. And bones per se, you require a lot of exercising. With obesity, exercises also reduces. And bones, say if you have to climb steps, you have to, your body weight, close to 4 to 5 times of your body weight is the amount of pressure that your knee has to bear. So knees wear out and bones also thin out. So you need to exercise regularly for increased amount of blood flow into the bones and increased amount of calcium deposition, which will make the bones stronger. But if you don't exercise, the bones start thinning out. You require a lot of calcium for all the organs to function. So if, for regular functioning of the organs, the bone starts losing its calcium and the blood starts reabsorbing the calcium and making the bones very, very weak.
So it's very important. I keep on telling all, especially all the female patients post 40, you know, we don't exercise. We feel that our whole day goes off in doing the household work, but that is not sufficient. If you exercise, if you do little weight training, your bones will become stronger. Okay, so obesity leads to less bone density and more chances of fracture. So this is for everybody, friends. So if you thought you are obese or you are on the overweight side, start exercising and, you know, start losing weight.
And treatment of this is also very easy. All you have to do is get your bone density checked and start calcium supplementation and early, so that you don't go in for trivial injuries leading to fractures.
So my next question to you is, all the patients that I see have issues with their knee joints. Like, everybody will have knee pain, and when they are young, I think you people just suggest them for the weight loss. I just want people to know what is the relation of weight and knee joints.
Yeah, I just told you about the amount of stress that your knee undergoes in a simple act like climbing steps. So when you're climbing steps, it is 4 to 5 times your body weight, 4 to 6 times actually. Your body weight is the amount of pressure on your knee. So if you're 120, you can calculate the amount of pressure. And if you are going to be around about 60, then it is going to be just about 200 to 250 kilos of pressure is what is going to be felt on your knee.
So it's a 4 times pressure on the knees.
4 times pressure on the knee when you're climbing.
So when you are
stairs.
100 kgs, 400 kgs the pressure on the knees when you are climbing stairs or doing any form of walking or exercise.
Something as simple as walking. Walking causes 2 to 3 times your body weight is the amount of pressure that your knee has to bear. So the more weight you have, the more is the pressure and the more faster it wears off. So earlier stages, yes, if you come to us, we will advise weight reduction and send you to doctors like Dr. Neha, who will advise you overall, how to address obesity overall. It is not just surgery that you have to do by the end of the day. If you come early to her, she will advise you on how to go about your weight loss and what are the different regimens that you can follow to successfully reduce your body weight. If you do that early, then the necessity for you to come and meet me or worsen your knee pain is going to get that much lesser. So look at things very early before it goes really out of hand, and start exercising early, start making your bones stronger, and try and reduce your weight as much as possible. And if you exercise regularly and keep your muscles around your knee joint much stronger, then the chances of you getting into knee pain is very less. In case you do get into a severe knee pain, then initial stages we give you medicines, and later stages, of course, weight reduction is one of the main thing that you have to do with lifestyle modifications like not sitting on the floor, not climbing steps, walking on flat ground, and exercising regularly. And then later stages we can give intra-articular injections, and last stage, if it is very bad and just walking up to the bathroom and back gets too much of a problem, then you have to go in for surgery. And knee replacement is a very successful procedure if need be. It can be done irrespective of your weight. Well, there are few criteria where we have to follow as far as weight and age is concerned, but if you fall into the criteria wherein I can operate on it, then it can be done successfully.
So I want to know, is there any age limit for the knee replacement? Like somebody is around 48 or 49 years and they have severe knee osteoarthritis because of obesity, increased inflammation, as well as the weight bearing.
Yes.
So is that age a correct age for the knee replacement, or should we consider some options for weight loss?
Well, it's a very tricky question. There is no age limit per se for knee replacement. The youngest patient that I have operated on is a 24-year-old, and the oldest patient that I have operated on is 88 to 90 years old. So there is no age limit per se, but what we are talking about, why limitation of age is spoken about, is because of the lifespan of the implant per se. The lifespan of the implant initially was around about 10 to 12 years, but with the modern development and scientific advancements in the prosthesis per se, the age of the prosthesis is now a minimum of 20 to 25 years. So similarly, the age of surgery has also come down. Initially when I started surgeries, it was around 60 plus used to get operated, closer to 70. But nowadays I am seeing patients as young as 40 having arthritis, and I am operating regularly on patients who are early 50s and late 40s. So it is not a good trend. But there are different modalities of management. If everything fails, is when we take them up for surgery. In younger age group, we do something known as unicondylar knee replacement, wherein the inner aspect of the knee is where the arthritis starts and it worsens there. If it is only the medial compartment which is worsening, then I change just half the knee. So that will give us another 10 to 12 years before the patient can go in for a total replacement. This happens when the patients are younger. And if the arthritis is very severe and it is debilitating for their day-to-day activities, then age is not a criteria, nor the weight. We have a limit. We don't go beyond 40.
Yeah, but I would like to tell the audience that if you lose weight, then your chances of recovering from the knee pain is much better.
Yes, you don't even have to go in for surgery.
Because many times I see patients, there are two varieties of patients that I see. There are some patients who are quite educated and they understand that, okay, fine, let me try to lose weight. And when you are young, even if your that joint is going to last for 20 years, if you are in 40s, then again in 60s you will again you'll be at the same rate.
Yeah.
So I feel that obesity definitely affects the wear and tear of the knee joint. As you told, it is 4 times the pressure when you start climbing stairs and things like that. So that is one thing. And obesity increases the overall inflammation in the joints.
Yes.
It's an inflammatory disease, So when the overall inflammation increases, that inflammation will give wear and tear in the joints also, as well as that inflammation only is responsible for a lot of malignancies also.
Yes, absolutely.
So if you are going to treat obesity, then lot of your future problems are going to come down. So that was interesting, this thing. Now I want you to little tell about, like we see a lot of patients with low back pain. And every time orthos are advising that okay, you lose weight and your low back pain will come back to normal, and they are the people who are not even able to exercise much because of their low back pain. So what is the relation of obesity and low back pain?
Any patient comes to us with any kind of pain, the first thing, if they are obese, the first thing we would advise them to do is reduce weight and refer you to Neha. The problem is everything becomes bad with obesity. As far as the knee is concerned, I just explained everything to you, and the same thing goes to your back as well. What happens with your back is the body weight. The pressure in your lumbar spine is because of your body upper and lower body weight meeting exactly there. So your dorsal lumbar spine junction is where the maximum pressure is, and the pain starts over there. And forward bending and all will, as you bend forward, you forget about the rest of the body. As simple as your head, when you are standing straight, the head, the amount of pressure on your neck is very, very minimal. But when you start bending your neck and it goes down just to another 30 degrees to 45 degrees, the pressure is 6 times. And when you're going down like this and watching your mobile, the pressure is close to 9 to 10 times the actual weight of the head. So your neck goes for a 6. So similarly, when you bend down, the body weight that you are having, and when you're obese, close to 120 kilos, the pressure that is going to fall on your dorsal lumbar spine is very, very high. The chances of disc prolapse gets very high, and you have to start exercising. And I think you must be having great regimes to start.
Obesity leads to disc prolapse as well.
Yes, absolutely. When you start bending forward and with heavy weight, it does lead to disc prolapse.
So obesity leads to disc prolapse as well as low back pain. So
low back pain could be because of the mechanical weight per se, because the muscles being weak and they are not able to hold this, as well as disc prolapse. So if disc prolapses, then yes, surgery is an option. But otherwise, I think just back exercises and weight reduction. Obesity, the first thing that you have to look into is weight reduction. Once you start going towards that, I think you will start feeling the positive energy in your body, as well as you will start understanding how good life can be and how light you can feel, and the advantages of that is innumerable.
A very interesting question I'm asking. I ask this to everybody. You tell the audience what are the exercises that an obese individual can do. Suppose somebody is about 35 BMI.
Okay.
What are the exercises that they can do without hurting their joints?
Okay.
If that person is a middle aged, like around 48, 50. And what are the exercises? Because nowadays there is another trend for gym, and they do vigorous exercises, and then we see a lot of injuries. So I want you to tell these people what is a safe limit, when you are a 48-year-old and you are weighing somewhere around 100 to 120 kgs.
See, the best thing that you can do is you don't need any trainer or anybody to help you. All you have to do is just wear your walking shoes and walk. You don't have to walk kilometers. You start off with just 500 meters to a kilometer in a day, and then slowly, gradually, as and when you feel comfortable, you increase it, go up to 4 to 5 kilometers in an hour daily. That will itself start helping you reduce your body weight and start getting physically fit.
So the best exercise what you are recommending is walking.
Just walking.
Right, walking. Walking
that's
is the
most
best.
Simplest. that's the easiest where you can.
Because a lot of people ask, can I start walking, running on treadmill? But then, as you told that the pressure on the knees is going to be 4 to 5 times higher.
Yeah.
Then chances of knee injuries and everything will be much higher. So I feel even what about swimming?
See, walking is simple, and everybody can reach to walking. Swimming, yes, if you have access to a swimming pool, you can surely go into the swimming pool. You don't necessarily need to know swimming. All you need to do is just walk in the swimming pool.
Just exercises inside the pool.
Yeah, just exercises, just walking, because because of the water buoyancy, you will not feel that much of weight on your body, and your knees are not going to get stressed. And doing all these exercises just strengthens your muscle, which is what you need. So walking in the swimming pool is good if you have an access to it. Otherwise, cycling. Again, cycling, what happens is you're sitting. So the weight, your whole body weight is not on your knee, and it is just a cardio wherein you're going to sweat it out, and all your excess amount of fat is going to get burned, and your...
So you feel cycling is okay as far as the knee joints are concerned?
Yes.
So walking, cycling, swimming. These are the. Do you advise running on a treadmill or
no? See, because when they are walking, they can increase or decrease the speed and do it comfortably in the style that they are used to. And the treadmill, the way they land their heel, if it is wrong, they will end up in heel pain. Something which is going to not let them even walk. So walk in a normal.
No EFX.
Nothing.
Yes.
So none of the machines are required. All you have to do is just wear a pair of good walking shoes and walk. That's more than enough.
Yes. So that was very interesting, because every time we keep on advising, but when they hear from you people, then they feel that okay, fine, this is what we are supposed to do. My last thing is, we see a lot of people with heel pains nowadays. Okay, they call it as plantar fasciitis, and
treadmill is one of the reasons for that.
Yeah, so treadmill is one of the reasons for plantar fasciitis.
Yes.
So we see nowadays in thin people also plantar fasciitis. So treadmill is one of the reasons for that. And do you think that obesity is related to heel pain, and somebody with plantar fasciitis and heel pain, if they lose weight, whether that will subside or...
See, plantar fasciitis is actually inflammation of the plantar fascia, but heel pain could be due to just the body weight landing. And see, our feet are meant to be made to walk on grass and mud, but we never do that. We are all walking on marble and granite and all hard surfaces as possible. So that's not good for the heel. So that's why we all start developing heel pain, and obese patients as well as people in IT and other industry where the activity levels are much lower, the bones get weaker. And when bones get weak, wherever you maximum, when your weight bearing is maximum, especially like your heel, your knees, your hip joint. Luckily in Indians, the hip joint doesn't wear off very fast, but the knee and the heel bears the brunt. So if you lose weight, you surely will get over your heel pain, and wear proper footwear. That's what I said. Wear a proper walking shoe and walk. That's more than enough. You don't need any kind of machine. In no time, matter of couple of months, once you start, doing that regularly, it is good. But matter of couple of months, a machine is going to be just a clothes stand. So that is what it happens in most of the houses. So you don't need to invest any money. All you have to do is, get your mind straight, focused on weight loss and being fit. And once you start doing it, I think there will be no stopping it.
No, that was really quite interesting. Friends, so we learned a lot of things today. I will just summarize the whole thing. Like, when you are obese, your bone density comes down, you have more chances of getting fractures and things like that. So try to come down with your weight. Check your BMI. If your BMI is about 25, you should start daily walking. And as he told, I think walking, swimming and cycling are the best exercises. And people who are obese, they have more chances of knee getting wear and tear and knee osteoarthritis we call. So if it is early stage of knee pain, then I suggest everybody show it to an orthopedic surgeon, find out that whether it's an early stage or whether there is something else. If it is only obesity related osteoarthritis, then you should start bringing down your weight, and I'm sure it is just going to help you like anything. Thank you so much for joining today. Thank you, Dr. Arumugam. Thank you so much for joining today for the program. Thank you so much.